Hi, this is Dr. Scott Boden, Chair of Orthopedics at the Emory University School of Medicine in Atlanta, Georgia. You are listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Scott Boden, Chair of Orthopedic Surgery at Emory. Doc, how are we doing today?
Doing fantastic, thank you.
Thank you for being with us. So starting out, what was your mentality heading into your residency, and how did that mindset change during your fellowship?
Well, going into residency, my number one priority was to get the best clinical training I could because, that was the main objective of residency. I had some interest early on in possibly going into academics, and so I was trying to also do some research, but my number one focus was really learning to be the best surgeon I could.
And kind of taking us through that chief year throughout your fellowship, what was your mentality heading into your first job search, and how that perspective changed in the beginning years of your career?
Well, I think first of all, for me, in choosing the subspecialty I did, because I had a research interest, which happened to be bone healing and bone regeneration, it's always good to have your clinical area match up with where your research interest is if you are interested in research. And so that meant for me, it was either going to be trauma, where you've got broken bones that are healing, or it was going to be spine, where you're trying to get spines to heal either from trauma or from degenerative surgery. So that led me into spine. And then the question was, choosing the right spine fellowship that's going to help open doors for me to get the kind of job I want when I'm done with fellowship. So if you're interested in a community practice, then there's certain fellowships that are potentially better fellowships to look at and better prepare you for that. And if you're interested more in an academic career, then there's a subset of fellowships that probably better prepare you in that direction. So having some idea of where you think you want to go is definitely important, at least in that division of, are you thinking academics or non-academics? And then once you've done a fellowship, which probably 90+% of orthopedic surgeons do nowadays, then it's a question of what's your mindset going into your first job. And I always tell people the same thing I followed was really find a group of people whose culture and approach to taking care of patients, taking care of staff, and taking care of each other as surgeons matches your own philosophy and kind of feels good. Unfortunately, a lot of people focus on things like salary and call and parking spots and PA support. And, over 50% of orthopedic surgeons end up switching jobs after 2 years. And I think a lot of that is, when we're first coming out, we have no idea what we should be paying attention to. So we pay attention to sort of the little things, but it's really the people and the culture and the philosophy that I think are more important in the long run than what your first year salary is going to be.
When you're going into that job search for you particularly, were you always focused on the academic side, or did you ever consider going private practice?
That's a great question. I think the people that tend to be the most successful and stay in academics are people that just have a level of curiosity and like asking questions and want to be constantly challenged. And a lot of times those folks are not going to be happy in community practice. So when I see somebody that's kind of an either or person, when I'm trying to give them career advice, that's usually not somebody who's going to turn out to be a long-term academic person. It's either something you gotta do, or there's enough obstacles in academics and challenges that you probably won't go into it, or if you do, you probably aren't going to last. So for me, I was pretty passionate about wanting to not only take care of patients, but also ask and answer questions that no one had asked or answered before, and potentially discover new things, and also enjoy teaching and inspiring the next generation. And that's a little harder to do, that whole package or that triad in a community practice.
What would you say were some of the keys of your success that shaped your early career as you climbed to the top of your industry?
I would say, in the beginning, again, trying to focus on being the best clinician that you can as fast as you can. and really achieving, clinical efficiency. And the reason why that's important is, we're constantly getting better as surgeons throughout our career. Even doing this over 28 years, I still feel I'm getting better. I'm not getting better as fast as I once did, but I'm not getting worse yet. And so the sooner that you can reach a level of proficiency and efficiency in the way that you speak to patients, sort through problems, actually do surgeries, run your life, the more flexibility that you can create in your schedule to invest that time in either doing more surgeries and caring for more patients, or teaching or doing research, or outside life things. But the achieving sort of maximal clinical efficiency early in your career is a huge benefit.
Now, seeing that you're the chair of the department, I understand you wear a lot of hats. Can you kind of take us through briefly the journey that brought you to becoming the chair?
Yeah, so when I was looking for jobs, it was at a time where if you were a spine surgeon and willing to go into academics, almost anybody would be happy to hire you. It was before there were things like budgets and managed care and things that are everyday terms now. So I had the opportunity to look at a lot of different job opportunities, and I was looking for one where I would be fourth or fifth person, part of a large clinical team, because I thought there was important to have critical mass if it was ultimately going to be a spine center that sort of made its mark on the map. And I also was, because I was interested in research and starting a lab, I didn't want to take a position where I would be stuck doing anything administratively. Um, Unfortunately, within 3 months of getting to my job, it turned out that things became unstable. The finances weren't so good. Some of my partners that I had, chosen from lots of opportunities around the country were disgruntled enough they were even thinking about leaving. And so, at a pure just environmental preservation and job survival, I got involved with trying to see if I could fix some of those, day-to-day challenges that the group was experiencing. And fortunately or unfortunately, within 6 months, found myself as the director of our new Emory Spine Center. So I ended up exactly where I was trying to avoid, because I really wanted to spend my early years taking care of patients and starting a research program, which is not so easy to do as an orthopedic surgeon. So the long-winded answer to your question is I kind of got stuck in it because the group said, "Tag, you're it." And I was, I guess, willing to do it because I really believed in the group and the institution and the environment and the culture, and really didn't want to just up and leave. And so I thought being part of the solution, was going to be a better way to preserve all the things that I liked about the job when I took it.
You touched on it briefly, but can you kind of talk about what advice you give to your graduating residents and fellows entering the professional job market for the first time?
Yeah, so I think, the first decision is, are you serious about academics, or are you more interested in a community practice? And then, it's kind of what kind of setting do you want to be in? Do you want to be in big city where there's heavy subspecialization, suburban, or more rural? And then, once they kind of decide if any of those factors or geography are an issue, then it's really about, as I said in the beginning, finding a group of people that seem to have similar values to you, about the way you approach patients, the way you approach challenges in life and in the world, and the way they treat their staff and each other. It sounds sort of simple and obvious, but as I said earlier, a lot of times people are worried about some of the fine print in contracts, and that's usually not why 50% of people at the end of 2 years end up having to make a move. It's because of those other sort of soft things that they really didn't pay attention to and investigate, and really kind of say, is this a group that I feel like I can be part of, and that we share the same values? Because there's always going to be ups and downs and challenges. I mean, this pandemic is just one example. And if you're with a group of people that have similar values, then, whatever the challenges are, you're going to work together and hopefully make decisions that you're going to be comfortable with. And unfortunately, I've got some friends that are part of groups where, there were some very disheartening things that went on in the way senior partners treated junior partners during the pandemic, and some very disappointing things that I saw. And it all comes back to, what are your values, and how you're going to approach challenges that you don't even know what they are when you first join a group.
Now, on that, regarding the pandemic, we saw a lot of candidates this year either get job offers pulled or get them renegotiated. And the big thing is for the 2021 draft class, as far as, how they go about, how they continue to network, how they continue to outreach to folks like yourself. What advice do you have for that?
Yeah, so it's a little hard to give advice for a situation that you've never been in before, right? None of us have been in the first year after a 100-year pandemic. We still don't know, when the vaccines are going to be out, how effective they are, how many people are going to take them, and will we be back to normal by next summer? And certainly the interview season right now is now through probably March, and so we're still in a time of uncertainty. So I think, the best advice I would give people is to really explore, more opportunities than you might have, be a little bit broader in your search, and talk about things like, how has the group handled the pandemic? How have they managed their finances? Did they furlough people? Did they lay people off? How did they treat their staff? Was there anyone that they were hiring last year? Did they honor their commitments, or did they not? Because, it could be a very similar situation as we get into next spring, which if this doesn't end or dampen the way we all think it's going to first quarter next year, we could, who knows, if it's a replication of March and April like last year, how are groups going to handle that? We honored every single contract of anybody that we recruited and had signed in our group. But, as you mentioned, not everybody did that. Yeah, I think the most important thing as a fellow on the interview trail is, to be yourself, and to really think about what's important to you when you're part of a group. Think about it like joining a family, and it's your work family. And families have challenges and disagreements, but if you generally share the same values, you're usually going to be able to successfully work through that. And the situations where, people don't, again, it's usually a culture and a chemistry thing. It's not the mechanics of, what you're getting paid, or, how many PAs you have, or that sort of thing. Obviously, you want to make sure you're joining a financially viable practice. You want to make sure you're going to have operating room time. You're going to want to ask what happened to the last guy that had this job that's no longer here. If that's the case, you're going to want to look at a practice and say, is it just a bunch of senior people, or is there a steady age distribution that suggests that that they've consistently recruited and retained their new hires? Or is it a practice where people come for a few years and then the young folks all leave because they never get made partner, and it's a constant churn? So, looking at the practice and the history of retention and the age distribution, whether it's academics or community practice, is something that I always use to judge the health of an orthopedic group.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.